Okay, so Steve, can you tell me what your situation was like before you came to the respite center?
Normal life. I'm still am a assistant manager for Jiffy Lube, and I had an apartment. Had a 10-hour day job. I had a series of blisters that occurred on the bottom of my foot. They didn't heal properly, causing an infection. That infection worked its way back into the bone, and subsequently, they ended up taking all 5 toes on my right foot. Um, it was a normal life, and within a few short weeks, couple weeks time, it went from normalcy to, all of a sudden I'm homeless. And
How did that happen?
because of the injury to my foot, I was out of work, so unfortunately I couldn't pay my rent. They ended up evicting me and locking me out of my apartment. I also lost about 85% of my belongings. I did spend one night downtown at the shelter, which
How was
I
that?
would never, ever wish that upon anyone. That was just a disastrous situation. I saw the people down there, and I just felt extremely bad. I did come back up here the very next day after spending the night down there. People down here are awesome. They are incredible. The staff
So
is.
tell us how you ended up here at the respite center.
They actually did an interview process. The facility that I was at previously contacted Circle the City. Unfortunately, the timing between them releasing me and Robbie, the caseworker that I interviewed with, getting to do an interview with me, that's what caused me to spend the night basically on the street. So they did an interview with me, and they asked a series of questions, find out if I'm qualified to be a patient here. They do have a strict code, I guess you would say, of who they let in as far as the extent of what the injuries are and the need for the medical care and the limited space that they do have here as far as the beds. I know they'd have
What did it? Can we just go back to what did it feel like being on the street that one night that you?
It was, I don't know, it was just crazy. They basically gave me a cab ride down, dropped me off, and I had several bags of clothes that I had. The Cass location that I went to, they stored it overnight for me. But I had, a pair of sleep pants and a t-shirt, and middle of January, it's not real warm outside, so I'm standing out there on crutches, waiting in a line with 150, 200 people, looking to get a mat on a floor, basically, and it was just something I would never ever want to experience again.
So what has it been like here at the respite center?
It's been great. The staff is awesome. They bend over backwards to help you with whatever you need.
How have they helped you?
Actually, the very first day I got here, I didn't have anything to wear. I actually got a shirt that they gave me. I got some sleep
I
pants
just
to
have
wear.
to tell you that looks very familiar. That's from one of our favorite donors.
Yeah, and I got this. I got some sleep pants. I got a few toiletries, deodorant, stuff like that. They provide 3 meals a day, so I don't go hungry.
How's your health?
Getting better. It's improving day by day. It's great. They also help with the transportation if needed to get to and from doctor's appointments. I go to the Arizona Heart Hospital for treatment on my foot. That's where the vascular team was that did the surgery on my foot. If I need anything, they do whatever they can.
You see a provider here?
Yeah, usually daily. Sometimes with new patients coming in and other patients leaving, they need to check in and check out the people coming in and leaving as well. So you don't see them every day, but for the most part, they want you to try and see a provider. My case is a little bit different than most. I am, I guess, a little stubborn, but I have been kind of doing things my way, which seem to be working out very well, and they understand that, and they're cooperative as far as doing that. I don't normally eat breakfast and stuff like that. But my health, as far as my medications and stuff like that, they take care of me. So,
Where would you have gone if you couldn't have come here?
I would have been on the street. The Cass that's downtown probably would have been able to help a little bit, but I actually had a machine, a negative pressure machine on my foot. It's called a wound vac, and it helped draw all the infectious stuff, contaminations and stuff off my open wound. I would have pretty much lost that, so the care for my foot itself would have been nothing. I mean, it really wouldn't have. They basically would have bandaged my foot, and that would have been about it. So they made sure that that wound is taken care of. They were doing at one time. I was having it done once a week here, as well as at the wound clinic. So it was getting done by both places.
How do the staff here encourage you or motivate you?
Just positive reinforcement. They're real helpful. Like I said, if they needed something from me, I was always willing to help out as far as getting information from other physicians as well as other facilities. I was at another skilled nursing location up in North Phoenix before I came here, so doing that, they just are real positive. They're real positive people.
Have you participated in some of the activities that we have here?
No, I'm not. I'm not a real people person.
Haven't discovered that you're an artist now.
No, not yet.
Did you feel that you were loved and cared for by the staff here?
Absolutely. They're so wonderful. They always have smiles on their faces. Did have a gentleman that's in the same dorm that I am, who had a few seizures, and I'm in opposite side of the wall from him in another cubicle, and I heard him and alerted the nurses to it. So they were really appreciative of the fact that I was watching out and helping as far as another patient that is staying here.
How do you think your life has changed?
Makes me a little more aware of what's going on as far as the homeless situation. I've in the past had to use food banks and things like that, so I've kind of knew about those, but being here definitely gave me another perspective.
Are you working with the case managers here to get back into your apartment? And
Yeah, I've worked with them a little bit. I'm also working with, they're also helping a little bit with Social Security disability, as well as um, giving me referrals as far as getting food assistance, through DES and those guys as well.
Those
So-
guys are amazing, aren't they?
Oh, yeah.
Oh my gosh.
They don't look and come off as
Not at all.
caseworkers. They
But I swear they've got those big, S's on their T-shirts for
Yeah.
Superman. They are incredible. They're
Yeah.
incredible. Let's say that you were talking to someone who doesn't understand the trials that you've gone through, what you experienced. What would you say to them?
It would be something that I would like somebody to experience, but I wouldn't wish that on anyone. You have to be there. You have to live it to kind of understand it. Whereas, you can see stuff on TV, reports in the news and stuff of the homeless and what have you. But unless you're down there standing in line to get food and have a dinner, or standing in line waiting for a little, 3-inch thick foam mat that you're going to sleep on for the night, it's an experience that, you don't wish on anyone. It's just terrible. I mean, it just gives you a different perspective on everything, from the health care to, just general living. I mean, being able to sleep in my own bed in my apartment, it's just been one of those things where I can't wait to get back and do that. It's just something that, I'm sharing a dorm room with 9 other people, and I have a place to stay, blankets to keep me warm, food to keep me fed. Do I want to get back and live my life? Absolutely. But in the same sense, it's been a great experience for me because I give it a whole new outlook on life. I mean, it makes you feel different.
Okay. Do you need to put a stop on it for a minute?